Entonces, sin mayor preámbulo, doctora Jara, la palabra es suya. Muchísimas gracias.
Thank you so much. I am not a doctor, but I feel very privileged to be amongst some wonderful colleagues from around the world today. So what I wanted to do in closing was to share a little bit about Canada's experience and just to share what we've been doing. And I'm really heartened to hear all the presentations today because I think we've been successfully applying a lot of what folks are saying today. So as mentioned, my name is Sarah McKenzie. I am the Director General of Strategic Communications for Health Canada and the Public Health Agency of Canada. And since January 2020, I have been leading Canada's public health pandemic communications response. So in these closing remarks, as I said, I'm going to share a little bit about Canada's approach to pandemic communications and how we've taken a risk communications approach since the beginning of the pandemic. I hope I can demonstrate the practical application of risk communications in the Canadian context. So we have been working very hard to ensure Canadians have the information they need to protect themselves and others from the virus. We are, working really hard to reduce its impact on personal health, on the healthcare system, on social life and the economy. And in the absence of a vaccine, it's been absolutely critical to emphasize the universal precautions that are needed at all times. Washing your hands, keeping a distance, staying home when you're sick, in order to stop the spread of the virus. And these universal precautions have been underpinning all of our government communications, not just public health, but what we are doing with business and the economy. Canada has taken a risk communication approach from the early days of the pandemic, and we continue to use harm reduction messaging. We're trying not to tell people what to do, but help them to adapt protective behaviors to prevent and stop chains of transmission of the virus. We communicate daily to Canadians to make sure that they have the information they need to protect themselves and to protect their at-risk family members. We need to help Canadians make informed decisions about safely participating in everyday life. And we've been doing that using a range of the traditional but also digital communication platforms. And we work very hard to address the questions and concerns of tens of thousands of Canadians over social media, through a national telephone line, and through the media. We've also initiated new ways to connect with Canadians, including a COVID-19 app, and a comprehensive website that is always changing and being updated with the latest information about COVID-19 and the risks. We've also been working with all levels of government, industry partners, tech companies like Google, Facebook, YouTube, TikTok, Twitter. We have stakeholders in various sectors that we are targeting, and we work with communities to support their ongoing efforts at the local level. So why are we doing what we're doing? Well, it's because our approach is based in risk communications. In a public health emergency, risk communications is all about helping people to adopt productive behaviors against a threat to health. And we're translating epidemiological information and the evolving science into plain language so Canadians can better understand what they need to do, why they need to do it. And we're providing Canadians with information they need, when they need it, in the right language and format. It's critical to reach those most at risk of severe outcomes of COVID-19. And we're finding that those groups can have, they could be immigrants to Canada. They could be people that don't speak English or French. Also, we are deploying everything from newspapers to radio to digital. We cannot assume that everybody is going to be online. Communications has been done in rapid timeframes and without knowing everything about the crisis. And our key is to provide accurate, credible, and timely information. What we know is risk communication only works when there is communication based on trust between those who know, the experts, and those in charge, the authorities, and those who are affected, which are our citizens. And without that trust, people are unlikely to follow the advice given. Explaining honestly what is known and admitting what is uncertain is essential. and the credibility of those giving the advice, and their expressions of caring and empathy, and identifying with the audience are factors that make risk communications effective. Listening to and understanding people's beliefs, concerns, and perceptions has been just as important as providing them with facts and advice. The inherent challenge for risk communicators is people's natural desire for certainty and closure and clarity. And for politicians and other leaders who want perfection of messaging, that is clear, that is authoritative, is a challenge. We have to make people to be comfortable with going out with key risk information when we know it, as soon as we know it. And that is challenging for some in this process. And relating to uncertainty is the fact that advice may change when more is known about the threat or as science evolves. And many of you talked about that today. And our messaging on masks is a good example of uncertainty and evolving science and the importance of contextualizing advice. And we learned through this process. We didn't always get it right. The use of non-medical masks by Canadians over time evolved and was a huge challenge for us. As a previous speaker mentioned, early on, there was no evidence of the protective nature of non-medical masks for the population. And our Chief Public Health Officer, Dr. Theresa Tam, did not recommend it. And she did that publicly at press conferences. Then evidence started to come out about how the virus was spread. And we communicated that Canadians may want to consider using a non-medical mask where social distancing was a challenge to protect others. And that it was not necessarily to protect the person wearing it. We even offered instructions, and still do, on how to construct your own mask. But things have evolved, and we do see many jurisdictions in Canada mandating the wearing of a mask in public and retail spaces. This has been a huge cultural shift. Mask wearing was not something that Canadians used or were used to. You couldn't even buy a mask in the early days of the pandemic. Most recently, with science on aerosol transmission, Dr. Tam is now recommending the wearing of masks in indoor spaces when interacting with people from outside your household bubble. And she has also adopted Japan's 3 Cs in her communications, which was mentioned earlier today as well. The reality is the media accused us of flip-flopping or changing direction. And, that was really undermining our credibility. We managed to do some pushback on that narrative through our spokespeople and media inquiries, really situating in, this is the information we know and our best advice. The science is evolving and our advice must evolve as we learn more about the novel coronavirus. So this leads me a little bit more to just commenting on communicating uncertainty, which in the world of risk communications is really necessary to build trust. Without a vaccine, again, we need Canadians to take steps. And it's okay to tell them we don't know everything yet. People will listen to advice and change their behaviors only if there is trust. And if there's trust, they're more likely to accept uncertainty, and that the doctor, for example, doesn't know or have all the answers at that point. That's okay. In Canada, the trusted voice is Dr. Theresa Tam, our Chief Public Health Officer. She was out early, holding her first media briefing in mid-January, and she continues to hold media availabilities twice a week and daily statements to the media and through her Twitter account. And while many people may not like communicating uncertainty, citizens can process it, especially if they're armed with some tools that help them make decisions. And if that information is coming from a credible spokesperson. So we actually developed a tool, which was an infographic and some other information for Canadians to work through what are those activities that are riskier behaviors and situations and environments, and helping people to make decisions based on their individual tolerance and the exposure to people that they may have who would have higher risk of severe outcomes. Maybe just a few points on challenges and considerations. While communications was essential and helped Canada flatten the curve during the first wave, there are still many challenges and complexity in communicating this unprecedented pandemic. such a large population with drastically different realities in various parts of the country. We have multiple voices, sometimes conflicting in a crowded environment. We have leaders in provinces and territories and local public health units that are giving advice based on local epidemiology. Our challenge is to try to communicate to all Canadians. Those regional differences in the epidemic causes a lot of complex information to be sent to Canadians and for them to understand. So we have to work harder to coordinate with our provincial and territorial counterparts to co-develop messages. We meet weekly to share information and communication strategies. We also have really learned the importance of engaging community leaders from very specific groups who have been impacted, like Indigenous communities, racialized communities, and faith-based organizations. If you look at Dr. Teresa Tam's annual report released in late October, she looks further into this issue, and we've done significant outreach to individual communities, written to faith leaders, and we've translated resources for the public and these specific groups in multiple languages. I would be amiss not to mention misinformation, and I know it's come up several times today, but the identification and management of rumors and misinformation also remains an important aspect of our risk communications. And it can impede the delivery of our information so easily and hinder our efforts. And we need to help Canadians fight through that. And we're working with several social media platforms and other ways to combat that. A little bit more about what we're doing, and then I'll conclude. So we put in place early on a phased COVID-19 risk communication strategy with different focuses, or phases, I should say. That included the containment and delay phase early on, tools and empowerment phase to empower Canadians to adapt those protective behaviors, mitigation and working together to flatten the curve. And the last phase was about perseverance and ongoing vigilance in the context of, reopening society and reduction of disease. Now, these are not linear. This strategy at different points of the pandemic, we've had to go back to empowering people more, to mitigating more. We are very much in our second phase, which I'll speak to at the end. But this really set out a really good strategy for us that we've kept updated. I've already mentioned the briefings by Dr. Tam. We've also had a lot of work that we've had to do on border measures and travelers coming and leaving Canada in multiple languages there as well to explain quarantine requirements. We've used all communication levers that we can. We have launched a comprehensive multi-million-dollar national public education campaign that provides advertising, social marketing, information resources across the board. But we've also done sub-campaigns. We are segmenting our audiences to more effectively reach those people at risk or the people that are non-compliant with public health measures. We need to impact their behavior. Some of those groups include seniors, they include youth, and include men under 35 who are non-compliant with mask use. And we've developed some really interesting digital tools in Canada, including the COVID Alert app, which is an exposure notification app, mental health portal with mental health resources that Canadians can access and services. ArriveCan, which is an app to assist travelers with managing their quarantine compliance and for us to manage that follow-up. And COVID Trends, which is an interactive online dashboard that provides researchers and Canadians with the latest data in a format that they can understand how the outbreak is evolving in Canada. Finally, one of the most important tools that have helped us is leveraging behavioral scientists to help test, craft, and evolve messages so we can address those non-compliant populations. We are using behavioral science to inform us about intentions to be vaccinated, and it informs campaigns to move people from being on the fence to getting the vaccine when it becomes available. Behavioral scientists ask really good questions. What choices are people making? What actions are they taking and why? And then we design and test solutions based on that understanding. A key principle in this is that while our beliefs and attitudes do influence behavior, there are many other important contextual features at play. And I think you've heard some of those today, from the social and cultural context surrounding a behavior, to the way information and choices are presented to us, to even the time of day and week when we are asked to choose an act. And by strategically designing or redesigning aspects of the choice context, including how and when messages are communicated and delivered, we're trying to drive, meaningful impacts on behavior-based outcomes. So in conclusion, communicating during this pandemic is becoming increasingly more complex. We are constantly adjusting our messaging and techniques. We're deploying new tools, and we're using the latest science to inform our communications. We are seeing a significant resurgence with higher cases now than we had in the first wave. And when Canadians listened to our national message, when it was stay home, stay safe, and save lives. But that no longer works. Things are so complex. And it's becoming more and more difficult to change behavior as fatigue with those universal messages. We need to target the groups that are non-compliant while continuing to rally Canadians to what our politicians are calling the Team Canada approach. Couple that with the global charge towards a vaccine under rapid development that in itself impacts trust and confidence and eventual uptake, things are not going to get any easier soon. And as one of the previous presenters already acknowledged as well, a vaccine is not going to mean an immediate return to pre-COVID life. We need to prioritize in Canada who's going to get those vaccines and when. This is not all going to be over the first day the first vaccine is delivered. We still need our citizens to follow those universal measures. So until that vaccine is out and we have mass immunization done, we will continue to help Canadians make conscious decisions about the activities that they will participate, encourage everyone to take precautions to lower their risk. At all times, Canadians will be washing their hands, keeping their distance from another, wearing a mask, and staying home if sick. Thank you.
Thank you so much. Sorry, go ahead.
Sorry. No, por favor, Shana.
No, I just wanted to say thank you. I think you demonstrated some of those principles in crisis communications in terms of recognizing when we've gotten it wrong and the importance of communicating uncertainty as well when that's the reality. So thank you very much. And with that, I'll turn it back to our very gracious hosts at PAHO. Thank you very much, Federico, Cristian Morales, for today's event.
Muchísimas gracias, Sean. Una hija de la Agencia de Salud de Canadá. Muchísimas gracias. Bueno, yo al final se extendió un poco, realmente bastante. Les agradecemos una vez más a todos los participantes que nos acompañaron durante estas casi 3 horas, los ponentes, bueno, todos. Agradecerle nuevamente a la Embajada de Reino Unido, de Japón, de España y por supuesto de Canadá, todo el apoyo y el liderazgo para hacer esto posible. Finalmente le concedo la palabra al representante de la OPS para las palabras de cierre y a todos los que nos acompañaron hoy. Muchísimas gracias en sus estados, en sus países, en sus localidades. Señor representante Cristian Morales.
Bueno, muchas gracias nuevamente a todos. En nombre de la doctora P.3, nuestra directora de la Organización Panamericana de la Salud, creo que hemos podido con este evento y con todo el trabajo que se ha hecho durante el año en apoyo a la pandemia, en este marco específico o en este ámbito específico de la comunicación de riesgo y el análisis de percepciones, cumplir con la misión de la OPS, que es facilitar las buenas experiencias y los conocimientos entre los Estados miembros para el diseño de políticas públicas que sean efectivas y que en este caso nos están ayudando a combatir la pandemia. Muchos fueron los involucrados a los cuales habría que agradecerles, pero creo que sin el aporte sustantivo de la Embajada de Canadá, del liderazgo del señor embajador, de Shona Hemingway y por supuesto del lado nuestro de Federico Vázquez, no hubiésemos podido tener esta rica discusión que hemos tenido esta mañana, gracias también al apoyo a los colegas de nuestra sede, tanto en Ginebra como en Washington, y a todos los que se interesaron, por supuesto, en esta reflexión. Acá en México tenemos el gran desafío de seguir implementando la estrategia de prevención, mitigación y atención a la COVID-19 con un enfoque de atención primaria de la salud, donde justamente la comunicación es una parte clave, es una comunicación que no es genérica, no debe ser genérica, es una comunicación que tiene que ser contextual, es una comunicación que tiene que ser adaptativa, tiene que ser flexible y tiene que sobre todo llegarle a la gente que está en los territorios, en las comunidades, que son ellos los protagonistas del año 2021 para que esta epidemia tenga cada vez menos efectos y los brotes y rebrotes sean de menor impacto.
Tengo la impresión que se desconectó. Si me confirman, pero creo que sí, ¿verdad? Bueno, en caso de que no vuelva por algo del audio, simplemente estaba haciendo una conclusión del tema de los rebrotes, el tema de las vacunas, la complejidad que esto va a tener también en esta etapa y que el mensaje debe ser muy, muy claro. La vacuna es una herramienta más para interrumpir la transmisión. No es la solución, hay que ser muy claros y tratar de influir en nuestra estrategia comunicacional para tratar de interrumpir la transmisión. Estas medidas preventivas seguirán y seguirán siendo muy importantes pese a la complejidad que ha tenido esto. Entonces, bueno, creo que era el mensaje final que quería expresar, aparte del agradecimiento a todas las embajadas y participantes y gente que está atrás, como Adriana también, un agradecimiento de la Embajada de Canadá, que sin ella tampoco hubiera sido posible. O sea, todo el apoyo y el liderazgo que se creó para esta actividad, que esperaremos pronto estar muy otra vez con ustedes con alguna propuesta pronto para que sigamos fortaleciendo esta cooperación. Sin más, creo, porque no veo que vuelva, yo daría por cerrado, porque creo que ya nos extendimos prácticamente una hora más, y muchísimas gracias en los países, en los estados, en las localidades, y por supuesto a Melinda, a mi colega Sebastián, a Sara, y a toda la Embajada de Canadá, España, Reino Unido y Japón. Muchísimas gracias.